Today we are going to be discussing the burnout being experienced by nurses working throughout the COVID-19 pandemic. Burnout is a common occurrence experienced by those working in many areas. However, we will be specifically looking at those working in the critical care area. We wanted to take a closer look at how the COVID-19 pandemic has affected burnout in nurses working with COVID-19 patients compared to those working with non-COVID-19 patients. Burnout can be characterized by emotional, mental, and physical exhaustion, frequent irritability, increased negativity and intolerance, depersonalization, and low sense of personal achievement. There are many determinants that cause burnout, such as a negative work environment, lack of time for patient connection, absence of work-life balance, and high-pressure work environments. These are all major causes, and unfortunately there are many others. As nursing students, it is essential for us to establish our own coping strategies for when we can feel ourselves getting stressed in order to prevent our own burnout now and in the future. Some of these strategies may include setting boundaries between work and personal life, getting fresh air, exercising, and seeking support when you feel you need it. Although these things may be easier said than done, a regimen must be established for self-care before one begins feeling burnt out. Even prior to the COVID-19 pandemic, burnout was prevalent, and now more than ever we are losing competent nurses who have either permanently or temporarily stepped back from their career that they worked so hard to acquire. This means the nurse-to-patient ratio is dangerously high, adding more pressure to nurses giving care and leading to prolonged stress and increased burnout in the ones left. This dangerous nurse-to-patient ratio means each nurse has less time to provide quality care and is at higher risks of having mistakes happen on their watch. Nursing burnout should become a priority for all nurses. If we all work together to better understand how burnout affects different people and ourselves, we can learn to better recognize, treat, and prevent nursing burnout.